Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. I'm your host, Samuel. And today we have with us two special individuals by the name of Karen DiMarco and Antra. They actually created a platform called Renegade that is changing the face of nursing education through CE credits. They're also patient advocates from their experience in nursing. And in this conversation, this is a two-part interview, we actually discuss not only what they're doing and how they got to where they are today, but the best ways to interact with the medical sales community from a nurse's perspective. As all of you know that are listening, this is Nurses Week, so it's my pleasure to bring two nurses that have had a wealth of experience to talk about their experiences and how they're impacting the medical community today. So whether you're a medical sales rep, you're someone that's trying to get into the field, or you're leading the way for medical sales professionals, this is definitely an episode you want to listen to. As always, thank you for listening to the Medical Sales Podcast, and I really do hope you enjoy part one of this interview. Hey ladies, how are we doing today?
Good.
Fantastic. Good to be here.
Nice to be here. Yeah.
Glad to see you guys as well. All right, so we have Antra and Karen DiMarco, but I will let you guys introduce yourself. Please tell us who you are and what you do.
My name is Antra. I am a nurse. I've been a nurse for 25 years now. Oh my gosh, I can't believe it. I graduated from my bachelor's degree in 1996, and I served in the United States Navy for 6 active duty years. That's kind of where I grew up as a nurse. I had a Filipino nurse that was a contractor teach me everything she knew about medical surgical nursing. And then I went to the recovery room, and I couldn't stand strong 20-year-old Marines. They were the biggest crybabies after surgery. It drove me crazy. These big muscular Marines, and they would just cry, and I hated it. So I went into the operating room where my patients were effectively asleep, and I stayed there for 20 plus years. But what I loved about the operating room was that I really got to be an advocate for the patient, because under anesthesia, they can't advocate for themselves. So it was a really good place for me to be, because that's really where my whole nursing career has kind of led me is advocacy. And really all nurses are advocates in whatever field they choose, but that was just front and center. That's what I did. Left the operating room to start my own patient advocacy business with another colleague of mine, because we were spinning our wheels inside the system. You know, we saw poor outcomes and we couldn't figure out how to change it from within. So we thought, well, if we can walk alongside a patient and help them navigate the healthcare system, maybe they'd have better outcomes. So we have a thriving business here in Portland, Oregon called Connected Care Patient Advocates. And if that wasn't enough, Karen and I, who we've been friends for a really long time, always knew we were going to do something. And we started a business to serve nurses, which we can talk about later.
Fantastic. Okay. So Antra, so right now you still practice as a nurse, or
I practice in the patient advocacy space. So I have my own consulting business, and clients will call me and say, I have cancer. I don't know what to do. I don't know what my treatment options are. My doctors aren't talking to each other. Please, can you help me? So they'll hire me to help them navigate that medical diagnosis. But it can be a range of things. So I am practicing as a nurse in that space, and then also working on this new company, Renegade.
Excellent.
It's probably the freest and purest form of nursing, because you actually get to use that critical thinking brain.
Got it. Okay. And Karen?
I've been a nurse for 28 years.
What year did you graduate? 96, right?
96, but I started nursing in like the ICU as an interning and stuff in 94. So graduated, went I'm covering my eyes, looking at a map of the Southwest, and my finger lands on Las Cruces, New Mexico. I was 22 and I packed my car and drove out to Las Cruces, followed the blue signs with a white H to the hospital because they wouldn't hire new grad in ICU in the Northeast, and there was a shortage in the Southwest. So I lied my way into an interview, and that was my first ICU job. And then ICU, flight nursing, trauma. I traveled, traveled as a single person, and then traveled following around my serial entrepreneur husband. And great experience, but same as Antra. I mean, if just kept seeing that if the patient was a medical professional or they had one in their family, they had better outcomes, shorter length of hospital stay, lower morbidity, mortality, just better, because they or the family knew what questions to ask or how to get a second opinion, and that just threw my justice scale off. So spent myself out of the hospital system 2011. I was done clinical nursing 2014. So that's when my practice became full-time for me. But yeah, private patient advocacy. I went through the same program Antra went through. And then that just evolved. It went into naturally patient advocacy, corporate wellness, and then did some research. I just kept falling into things, and then I collect C-glass and coaching certifications. So then added that to my practice and working one-to-one with people, and then doing a lot of health teaching, psychoneuroimmunology kind of health programs all over. So then Antra and I started this fun shindig.
Excellent. And you also practicing nurse as of today?
I'm not practicing as a clinical nurse. I'm not practicing purely like Antra is practicing. I would say I do one-to-one work and use my nursing brain, but it's more of like a hybrid.
Got it.
Nurse, coach, health educator kind of thing.
Makes sense. Okay. So my question is, both of you saw the need for private patient advocacy. You wanted to be a voice for patients. What happened in the nursing space that turned you on to that made you say, you know what, there's a problem here and this needs to be addressed?
Well, for me, it was inside and outside the nursing space. It was hearing friends or family members outside of the hospital say, tell me their horror stories. Not that I was unfamiliar with them. I saw them all the time, but the feeling of, oh, if I was there, that wouldn't have happened. If I could have been there, that wouldn't have happened. So that's what inspired me. It was like, I have to be there. That feeling inside of me, like I could have done something if I was there. I would have known what to do. I would have known what to ask. I would have known what to demand. Just the standard of care, dude. Can we, so that was it for me. I don't know if that answers your question, but
for me, it was, working in an operating room and seeing how poorly teams were together, how they didn't collaborate, how they didn't, how somebody could come in a bad mood and it would throw everybody off. And you could see, a direct correlation between a dysfunctioning team that didn't communicate and how a patient did. And while I was lucky enough to really never be part of a really poor outcome, I saw poor outcomes, in 20 years, you're going to see them. Right. And I tried in the hospital to really change those dynamics. We brought in stuff like, effective communication and, all of these different things that were in style at the time. But anyways, and I'd go in and I'd in-service everybody, people that I loved to work with, people that I knew really well. And they would sit in an in-service and look at me with just pure disdain. Like, what do you mean? That's not going to work. That's not, and it was just so frustrating to see that people didn't really get it. And then the other thing was the silos of care. Like the operating room is a silo of care. And what happens to a patient when we move them from the operating room to the recovery room? What happens to the specimens that we take out for a cancer diagnosis, perhaps? So many things get lost in communication between silos of care. And I hated it because patient champion, better communication, all of these things trying to improve. And it was just spinning my wheel. So I was like Karen and spit myself out of the system. I was like, oh my gosh, I could help somebody so much better on the outside.
Got it. So when you guys say on the outside, as patient advocates, who are you impacting? Are you impacting patients and their families to be better advocates for themselves? Are you impacting education around office staff and the providers to do better? Are you impacting a different perspective? Who's really being impacted as the patient advocates you guys are?
Well, first, the patient. Okay. I mean, number one.
So you're training the patients to be better voices for themselves.
And their families. Yeah.
And their families.
Got it.
Yeah. It's kind of like you could use the justice system. I often use that as a metaphor. Like in this country, if you cannot afford an attorney, one will be provided for you.
Sure.
Why? Because the judicial system has its own language. It's convoluted and so complicated, and you have to have an advocate for you to protect you from loss of, from fine or loss of freedom, right? That's kind of the two outcomes. In the judicial system, your risk is fine or freedom. In the medical system, it's injury or death. I mean, there's so much that goes unreported, and stuff that is in some, there's a debate, but in some areas, our medical system is the third leading cause of death in this country. And that's not even nursing home and medical errors and things that go unreported. And there's a real problem with reporting. Let me tell you, I was discouraged to not report things that went on. So you have the hospital ombudsman and risk management. That's like the basic level of one that will be provided for you. But then you can also, in the judicial system, hire a real shark, right? You can hire somebody who's really skilled and really good at defending people. Well, unfortunately, people who hire us are those people who can afford a pricey, high-priced attorney. It's kind of in parallel. But I would say the other thing that kind of bleeds out is when we teach the patients and the families and educate them how to advocate for themselves. Not only does that spread, like that's how I got into corporate wellness. I was hired by a guy who owned a company, a CEO, and totally turned, worked with his wife and then worked with his daughter and then worked with him. And he's like, why doesn't everybody know this? Like, you have to come in and teach my staff. I want this from my staff. I want this from my community. And that's how it got out and spread to other people. But unfortunately, the people who we have to keep the lights on, and the people who need us most, the most vulnerable people, are the people who can't afford us. So that's why we're also creating educational programs, and we do a lot of pro bono work too. But
and when you think about it too, like, patients don't know that they can ask questions and to demand, like Karen said earlier, the very minimum standard of care. They don't, because in our country, we've been so conditioned to believe that the doctor knows best. And so it doesn't occur to us that we can disagree, that we can get a second opinion, that we can ask questions. And so a lot of the work we do is teaching people, no, you don't have to be afraid. You can ask questions. And in fact, physicians and providers like it because people are engaged in their care. They're actually taking an interest in their own health. And so, as advocates, we're not only like teaching patients that, but we're helping the providers because we make their job easier by teaching these patients these skills and by reinforcing what the physicians, the providers are sharing with their patients, so that if a physician has 5 to 10 minutes with a patient in a primary care appointment, he can speak to whatever he needs to speak to in that short or her in a short amount of time. And then we can come in and say, okay, this is what he said, so that the patient doesn't leave the office and be like, okay, I have no idea what that even means. And that is the standard. Most patients have no idea. And if they're being faced with a really serious medical challenge, then they don't even hear it in the first place. So how are they ever going to get the education when doctors don't have the time, and when they don't understand, or they're, up in their head about something scary that's happening to their bodies? So it's been a super effective way, in my experience, for patients to get the best care, and for providers to make it easier on them.
Got it. So when it comes to this, you mentioned teams. You worked in a number of teams where you felt if the team worked better, there would have been a better outcome. And this is what kind of prompted you to want to get involved. When it comes to this, do providers see you as a friend that's going to help the whole system be better? Or do they see you as, oh no, here come Antra and Karen correcting our patients and getting them to have a voice? I mean, how is it perceived?
It depends on their level of insecurity.
Depends on their level of insecurity. Hey, you know what? If it is what it is. Okay, so I see. So it's a unique experience
I'm just
based
kidding.
on the
Kind
based
of.
There's some truth to that though.
Okay, I'll receive that. Now, think back to when you two were working with your teams, and there's an element in there that's very relative to our audience. That's the medical sales professional. Just so people can understand, because a lot of people that are listening either want to get into medical sales, or they're in medical sales, or they're somehow connected and understand enough about medical sales. How, from your experience as nurses, how important is that medical sales role? And speak to I want to hear it for the medical device side and pharmaceutical side, but let's start with the medical device side. How important would you say that their role was from what you guys saw?
Well, I can speak to that side. You speak to the other side, Karen. I would say it's key. Like, as an operating room nurse, I was always working with medical sales reps, always learning about new medical devices. I mean, I was an orthopedic joint nurse, and I remember when the robotic, the Mako machine for total hip replacements came on board. I mean, that is incredible technology, but it's complicated and it's complex. And so having that medical rep there in the room to help the entire team learn the equipment and use it the way it was designed to be used, with no workarounds or MacGyvering this or that, which, I mean, nurses are great MacGyvers, but that's, you definitely don't want to MacGyver a Mako machine. That doesn't make any sense, right? And so having them there and having them to teach and to educate was imperative. Like, you couldn't do it without them. Sure. In my experience. And what I found was that they were the ones that were good at what they did were extremely knowledgeable. Like, they knew their stuff backwards, forwards. I'm sure they could recite it and talk about it in their sleep. And that was so helpful to the team. So helpful. It was like, oh, there's, the surgeon can do what the surgeon needs to do, which is surgery. And I don't, and they don't have to rely on us to get it right exactly, because we didn't have that education, right? We get kind of the watered down of what a medical sales rep in that position gets, because they go through some really extensive training. And so some of my really good friends are medical sales device reps, because they just not only were really fun and engaging and kind and, cool people, but also they knew what they were doing. And I had mad respect for that.
That's awesome. Sticking with that,
I just had a really good idea.
Regarding medical device sales reps?
Yeah.
Okay, spit it out. Let's get it. And then
this is like,
don't let me forget.
Well, no, we can stick a pin in that. I'm not going to forget it.
Yeah.
Okay, don't forget. All right. So when it comes to these medical device sales reps, earlier you mentioned, going back to these outcomes, and you wish you'd seen teams work better. Medical device sales reps are part of that team. How much, for those listening, how much of an impact can a medical device, outside of their knowledge and the fact that they are a main resource, because, that procedure is utilizing their device, how much can they impact this chance to have this better outcome that you were discussing? Like, what role can they step up to play to make sure it happens even better?
Well, so I think that the ones that are really good at what they do are the ones that engage the whole team, and there's not a hierarchy. There shouldn't be a hierarchy in an operating room, because we all have jobs to do, right? We all, even the person that cleans the blood up off the floor. Listen, I wouldn't know what chemicals to use to clean the floor. So I wouldn't want to send my patient into a dirty room covered in blood. So we all have a really important role. And the hierarchy in an OR, well, I understand that the physician is the lead on a team, which is fine. We need leaders. We also have to have respect, and just really solid respect for every member of the team. And I think medical sales reps go a long way in helping to create that dynamic, because they see the surgical technician as equal to the nurse, as equal to the surgeon. The ones that are really good recognize that we're all part of the same team, that we're all trying to get the best outcome for the patient. So in my opinion, the best ones are the ones that recognize that, and they engage with everybody on the team. And they don't, speak just to the surgeon, or they don't speak just to the nurse. They talk to all of us. They teach all of us. A lot of times there's education that the anesthesiologist needs to know.
Sure.
That, housekeeper needs to know, right? How do we effectively clean this machine, make it ready to go for the next case? So that, in my opinion, that's the best thing a medical rep can do, because that promotes good outcomes, is a team that effectively works together well, that communicates together well, that learns. The medical rep has stuff to learn too, right, from us. What about the patient? What important things does the medical rep need to know about a particular patient? What do they need to know about a room that we're using? What do they, so there are things that medical reps need to be open to learning as well. And those ones that are, they make an excellent part of the team.
Excellent. Karen, please give us your idea.
Well, I have a question for you. Do medical device reps, are they looking for new ways to innovate to get their device that they're representing out to more hospitals in utilization more? Like, is that part of what they do, or is this just like a standard practice?
Well, it depends. If you have associate sales reps, you have sales reps. It depends on what your specific role is. You have clinical specialists, but any general sales rep or sales professional wants to be able to have their device utilized by more accounts. Simple as that. So they are looking for ways to do it. Well,
I was just thinking, my brain was still on the patient advocacy thing, and how when we educate communities, people where health literacy is not that great, those people know to demand the standard of care. And that from bottom up kind of thing is what improves, what will eventually from a grassroots level improve patient safety and probably the medical system, when they know that they can demand better staff ratios. I'm not bringing my mom here. Are you kidding? You like 4-1 in an ICU? I don't think so, Mom. We're not going to the hospital, when they have that level of knowledge. So I was applying that to you guys. Do you do community education programs? Like, say there's this hospital uses the latest robotic device in their surgical centers. Well, if the community knows that stuff and they're going to those hospitals, I don't know. There's just something.
They don't know, Karen.
Yeah, I know, but there's just some big thing there when people know. It's like the pharmaceutical companies' commercials on TV at night. You never see this hospital has the, blah, 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 blah. Like strikers, la, la, la. Go here. That could be a whole uncharted, untapped way to improve and grow a particular device or a whole company. They haven't even tapped into
true. Do you know how many clients I've had who call me and they're like, I'm having my hip replaced, and the doctor I'm seeing is going to do a hip replacement, and he's just gonna make an incision and do it the way he's going to do it manual. Are there other options?
Yeah.
Like, they don't even know that if that particular physician doesn't do a robotic surgery, they're not going to tell them that that's an option. So how do you even know?
Yeah.
Okay. So you guys want to see from medical device manufacturers, we'll stick with just them.
Mm-hmm.
Want to see more education to the patient around what procedures they're going to experience.
Well, to people in general, like that. See, to me as a patient advocate, I want my clients to make fully informed decisions. The hip surgery is a great example.
Mm-hmm.
If they're only going to one doctor and he's going to do it the way they've been doing it for 50 years, and maybe he's really great, but I want my client to have the benefit of making a fully informed decision, and also have the robotic, robotic option.
And if you were a medical sales rep for Mako machine, for example, or whatever robotic machine is out there, not only would you increase your sales by educating the public, because then they would demand that that's what they wanted, but then they would also they'd also be fully informed.
Yeah.
So there depending on the condition, some devices have entire community liaisons that are where the sales rep is actually involved in recruiting patients to be eligible for the procedure. So it does depend on what condition we're talking about.
Yeah. Where would you reach people to, unless it's like a podcast? Like, where would you reach a huge audience of people to let them know about the latest devices, outside of the hospital system?
Yeah, and I wonder, as far as patients are concerned, if that can get pretty technical for the patient to really understand what's going on, right? When a patient hears that a certain procedure needs to be done, how technical do you get with that patient?
Well, I think, Antra just told about, what it's like in an OR, and it's a brilliant example. But when a medical device rep's going on a floor, how many times are you talking to the patients? I mean, you really want people to understand and be clear? Learn to teach patients.
Right, but then you go into what will
Conflict
the
of interest.
manufacturer allow and compliance, and a lot of sales rep, they're not allowed to talk to the patients.
They're not? Well, that's
Well, it depends on again, it depends on the condition, depends on the disease state, but for just compliance issues alone, there has to be some lines of separation depending on the disease state, depending on the condition.
Yeah, I think I'm more talking about the clinical specialists who go and teach the staff how to use equipment that has just been purchased.
Okay.
Like if you can teach it to a 12-year-old,
Right. You're saying if you can break it down to make it easier for the patient to understand and include them in the process, then everybody would see better outcomes.
Well, that's where you get the collaboration, because if you have a medical rep who's teaching me, the nurse, this stuff, then I can distill it down for the patient as long as I really understand it and know it. And oftentimes I do that. I do that with joint replacements, with what are the options, and it's pretty simple, like, hey, this is why you might want to try talking to a physician who does it robotically. That doesn't mean that a physician who doesn't do it isn't as good, but this is the advantage, and I can distill it down. But I think that to your point and earlier question is, that's why it's important for nurses, clinical specialists, and medical sales reps to be like this, because to be tight, because that's how patients get those options and the better outcomes. And
got it. Okay. On the pharmaceutical side, Karen, what are you seeing when it comes to how pharmaceutical sales reps can provide more value to their clients from a nurse's perspective?
Well, Antra wanted me to take this one, and I'm afraid I don't have much to say, except I loved when they would come in and teach. And to kick it up a notch, make it so your audience isn't going, where the hell is she going with this? They've probably already done that a couple times, but I worked night shift most of the time, so I didn't get to see him that much. But when I worked day shift and we'd get an in-service, a lunch and learn, or an educational program, that interaction, I'll be honest, like in the areas I worked, it was always so busy, and I didn't get that much interaction with them unless we were, they were teaching us about a new drug. So I don't have that much to say, except I love them.
Now, would you have liked to see more interaction? Would you have wanted to see
I would have
more
loved,
go out of their way?
I would have loved to, but the longer I was in nursing, the less time I had for anything but trying to keep my nose above water.
Got it.
And that's kind of why I ultimately left, was because there was only so much energy and resources to go around. And the people who had an advocate with them was where those resources went to. And I didn't want to be part of the division anymore, and when the nurses, this is the unfortunate truth, and medical sales reps, and pharmaceuticals, because they have a body of knowledge about the standard of care that should be delivered. The unfortunate thing is the staff is on their toes when they know they're being watched.
Got it.
I don't know that I kind of just went off on one, but it's about, unfortunately, I didn't have that much time to interact.
But that's the thing, I think, on the pharmaceutical side, because they're going into doctors' offices and they're going into, areas where the nurses just don't have time. I think that's one area where medical reps could get innovative and figure out ways to create those relationships, knowing that nurses were crunched for time, that there wasn't, that you couldn't really interrupt them in the middle of a busy ICU shift, or that, where would you find them and where would you develop those relationships? Because in an operating room, it's easy. They're there and you're working with them, right? All day long.
Right. You're vying for their attention in an office setting. It's a lot more of a challenge.
Yeah, or in an ICU or on a med surg floor. You're just not going to get that. So I would encourage any medical sales, pharmaceutical sales rep to really think about, well, how do I develop relationships with nurses in these places? Because it's not just the doctor. The doctor's going to give you time depending on, however it is that you guys, get FaceTime with them, right? There's already that kind of relationship because that's how you guys sell pharmaceuticals. But how are you going to get in front of the nurses, and how are you going to teach them to teach their patients about these drugs so that these patients get better outcomes, right? And it might just be, I think it lies on the medical sales rep to do that because nurses can't. There's just no time.
I remember my brother's a surgeon, and when I lived in Cleveland, a couple times that he was invited to these fancy dinners, pharmaceutical things, or he's a surgeon, so there was medical device things where you talk about new devices, and I'm like, we're at this place called Blue Point. It was like in Cleveland. It was like this like really nice seafood restaurant. I'm like, these are the things you go to all the time. I'm like, nurses never get invited to these things. The only way I get invited is if my brother's date. I'm like, but at the same time, that's understandable, right? Because nurses don't really have control how they should, because they're the ones kind of running the show, but they don't have as much control over what gets purchased,
And they should. I mean, I'll tell you, at a big operating room conference, the floor when we go to the expo is all medical device. All like it's a, massive auditorium. And you know who goes there? It's not the physicians that go to that conference. It's the nurses. It's the clinical specialists. It's the educators. They're the ones that are at that conference. So it behooves any medical device pharmaceutical rep to get to know the nurses. It doesn't matter what area a nurse works in. If they can get in and develop relationships, there's influence there.
So let's talk about that for a second, because you made a really good point. You said, it's really up to the example you used was pharmaceutical. It's really up to that rep to figure out how to get that nurse's time. Think back to when you guys were busy and you guys were making things happen, and a rep tries to stop you to get your time. What do you want to hear from that rep that would even allow you to consider, okay, let me stop and give them a couple of minutes? What kind of approach would you be most receptive to? And this is completely subjective, but I'm curious to know. And that was part one with Antra Boyd and Karen DiMarco and their platform, RNegade. Make sure you tune in next week for part two as we dive a little deeper into what they're doing, their perspectives on the medical sales community and how to interact, and how they're changing the face of nurse education and making connections across the medical sales community with people that are all about patient advocacy and impacting patient outcomes. So maybe you're listening to this episode and you're thinking to yourself, I really want to understand more about what these ladies are doing. I want to work with people like these ladies. Maybe you're a nurse, or maybe you're someone in a different industry, or maybe you're someone that's just always thought about being in the medical sales industry. Well, if that's you, then you need to visit evolveyoursuccess.com and select Attain a Medical Sales Role and get in touch with someone from our staff here at Evolve Your Success and learn how to get into the position of your dreams. So many people are learning more and more about this field, and they're looking for ways to get in. Stop being one of those people. Be someone that actually gets in. Take a big step towards making that happen. Visit evolveyoursuccess.com and select Attain a Medical Sales Role. And if you're someone in the field, you're thinking, what? I want to have better interactions with my accounts. I want to get better access. I really want to earn more this year, or do more this year, or attain President's Club within my organization. If you're in the medical sales field and you want to make new moves as a sales rep this year, then again, visit evolveyoursuccess.com, select Improve Sales Performance, fill out our short application, and get in touch with someone from our staff and learn how this can be a groundbreaking year for you. We always do our best to bring you guests that are bringing innovations, insight, and different ways of doing things within the medical sales community. So make sure you tune in again for another episode of the Medical Sales Podcast. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive-level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.